All right, good afternoon, everyone. Wonderful to see you all here. This is a very exciting day and time indeed. These are success stories that we really need to tell. We need to tell them to the population, to our government representatives, our funders, so that we actually get the strong message of the University of Calgary's research strength out to the public. This is absolutely key. So thank you very much. Congratulations to our winner here, awardee. But these are really exciting times for us. And it's a pleasure for me to welcome you here. My name is André Buret. I'm Associate Vice President Research at the University of Calgary. And Bill Gali, the Vice President, actually has to send his apologies currently in Singapore. And he is dying in the heat. I was on the call with him this morning and he says, "Oh boy, I can't wait to be back." So I said, yeah, it'll be different when you come back. So listen, first of all, I would like to take the opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, Kainai First Nations, as well as the Tsuut'ina First Nations, and the Stoney Nakoda, including Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to the Métis Nation of Alberta, Region 3. I'll also obviously welcome our honorable guests, the Honorable Nate Glubish, Minister of Technology and Innovation, and MLA Strathcona Sherwood Park. Thank you very much for making the time. We know what your schedule is like, so we are very grateful for you to be here today. Also acknowledging the presence of Tim Murphy, Vice President Health of Alberta Innovates. Good to see you, Tim. We haven't been in touch for a while, so it's good to see you here today. Dr. Braden Mans, Associate Chief Medical Officer for Strategic Clinical Networks at Alberta Health Services, and Dr. Prism Schneider, Associate Professor of Orthopedic Surgery at the Cummings School of Medicine. Welcome you all. I'd also would like to welcome Dr. Beverly Adams, Vice Dean of the Cummings School of Medicine, who is also here to celebrate with us. As I said, I do bring the greetings of the Vice President of Research, Bill Gali, and Ed McCauley, who unfortunately could not be here today. They're both in Singapore, as I stated. So the University of Calgary is really thrilled to be hosting today's announcement. Investment in university research is an investment in the future of our province. And there are a lot of examples out there to support the fact, that a great university makes for a great society and a healthy society. And we need to get that message out there. We need to support university ventures. We need to support researchers and research activities. It does make a difference. Alberta is home to a robust and dynamic health innovation ecosystem, something that also we've made great strides in, and that we now at the University of Calgary start to be recognized for nationally, for sure, perhaps beyond already. And our access to the innovation quarter, just on the other side of the highway here, makes a big difference, very, very punchy difference in our ability to deliver on innovation. This innovation ecosystem indeed empowers our researchers to develop bold new solutions to society's most complex problems. Research leads to economic diversification, very important point, and growth. Again, research, university, education does make for a greater society. It translates to a more sustainable future for Albertans where everyone can flourish and succeed. The support being shown today by the Government of Alberta will enable researchers to help transform our health system. It will lead to better health outcomes for Albertans with the potential for positive impact on a global scale. It's an exciting day for everyone involved, and we're grateful to be part of it. So now let's get started, and I'm pleased to welcome the Honorable Nate Glubish to the podium for today's announcement. Thank you very much.
Well, thank you very much for having me. I'm really excited to be here at the University of Calgary to talk about some really good news. Before I get started, for those of you who don't know me, before I was an MLA, I was a venture capital investor for the better part of 15 years, investing in and helping to build new technology companies right here in Alberta. And so I know firsthand the power and the possibility of technology. And I know that some of the most exciting innovations that have come out of Alberta had deep ties to our post-secondary institutions, many like the University of Calgary. And so that is a testament to the fact that research is so important, and investing in research is so important. So I'm glad you could all be here today to talk about some of this good news about research happening right here at the University of Calgary. The health and well-being of Albertans is a top priority for our government, and that is why our government spearheaded this collaboration between Alberta Health Services and Alberta Innovates to create the Partnership for Research and Innovation in the Health System. This program connects innovative ideas from researchers in our health system to the funding and support they require to transform these ideas into groundbreaking health solutions. Solutions that will actually make a difference in the lives of everyday Albertans. Funding innovation in healthcare gives innovators in Alberta a competitive advantage and creates a strong health innovation ecosystem. And so today I'm proud to announce that 8 projects were successful in receiving a total of $9.6 million in funding to advance innovations in the development of modern health solutions. These projects have the potential to identify and mitigate health risks so that patients can get the care they need sooner, and to get more targeted care that will deliver better results for them and to help them reach their fullest potential and be the healthiest they can be. And in many cases, helping to avoid the need for complex interventions later on or more costly hospital visits. All of this is good news for our healthcare system. All of this is good news for Albertans, and it wouldn't be possible without investment in research like what we're talking about today. All of the projects selected had to demonstrate clear pathways to enhancing Alberta's health technology sector, and one such project is the work that Dr. Prism Schneider is leading here at the University of Calgary. She and her team will, I hope, have a little bit more to say about what they're working on here today, but I know that they are working on looking at early detection for those with osteoporosis as a part of a novel provincial outpatient fracture liaison service. And for those of you who want to know what that means in English, she's here today to tell you all about it. Dr. Schneider will be building her work on the success of previous pilot projects while addressing osteoporosis care gaps here in Alberta. She and her team will deploy a modern health solution using a smartphone app, a website, and virtual patient and specialist support to alert, educate, survey, triage, and communicate with participants, all of which will help to better improve patient care in this important field of medicine. Of the allotted $9.6 million, Dr. Schneider's project will be awarded approximately $1.2 million and will have 24 months to complete their proposed work. Alberta's government looks forward to seeing the results and the impacts that this project will have on the province and on the outcomes also of the 7 other selected projects that are part of this funding announcement today. We are very excited to see how emerging technologies like virtual and augmented reality, or new developments in sensors and wearables, or mobile health applications, or other analytics tools and 3D modeling, all will be able to help shape the future of how we deliver healthcare. Again, with a view of delivering better care, faster, and better outcomes for Alberta patients. So thanks again to Alberta Health Services and to Alberta Innovates for their contributions to this important announcement and to this important research, for coming together to help identify and find solutions to address gaps in our healthcare system. And thank you to the successful candidates for their important research and their innovation and their entrepreneurial spirit, and for the hard work you're doing to improve the lives of Albertans from all across this great province. This $9.6 million investment is our largest ever investment in this type of electronic health solution. And by tapping into the brain power, the talent, the expertise that we already have in our post-secondary institutions like the University of Calgary, we will be helping to improve the healthcare system and make life better for everybody. So thank you. And now I'm excited to pass on the podium to my friend and colleague, Tim Murphy from Alberta Innovates, to say a few more words. Thank you.
Good afternoon, everyone. It's a pleasure to say a few words at this very special announcement about the Prius, the Partnership for Research and Innovation in Health Systems. Thank you to the University of Calgary for hosting this announcement, and thank you, Andre, and thank you, Minister Glubish, for your kind words. They are very much appreciated. Alberta Innovates is the province's most comprehensive research and innovation agency. We're focused on putting innovation into action to create a competitive health innovation ecosystem that benefits the people of Alberta while driving economic growth. A strong health innovation ecosystem is key to solving all the many challenges our health system faces today. In addition, it will attract investment and grow the talent pool Alberta needs to fuel the future health economy. It's built upon research that is conducted in institutions like the University of Calgary, and it's also based on forging partnerships with our post-secondary institutions across the province, as well as with our great partner with Alberta Health Services, who helped, from inception of this program in 2014, create the Prius program. It is often said that collaborations are easy, co-design is tough. Together with our partner, Alberta Health Services, we're identifying and co-designing solutions to improve healthcare quality, health outcomes, and the overall value for all people in Alberta. The Partnership for Research and Innovation in Health Systems is a long-standing partnership with AHS that aims to address large-scale challenges by deliberately driving research and innovation into practice and policy. This program sets Alberta apart from every other jurisdiction in Canada. Every industry today is a tech industry, and I've heard you say this, Minister Glubish, at many announcements. Think of advertising with Google, music with Apple and Spotify, taxi and transportation with Uber, hospitality and travel with Airbnb, food and agriculture with DoorDash, Skip the Dishes, and John Deere. All of these businesses are technology-driven businesses. Also, in every other aspect of our lives, our consumer experiences are more personal, they're more connected, and they're more individually enabled. And so too should our healthcare system. Our expectations of what modern healthcare should feel like are set by the high bar we experience in other consumer settings. This is why we are looking forward to adding the technology dimension to our care models will help, and how it will help inspire researchers and innovators in this Prius program. This is the 7th iteration of the program to use digital innovations that support the development of care models to drive positive change in the health system. As a first of its kind for Prius, we're excited to see the possibilities that will arise from this joint initiative. This $9.6 million investment, as the Minister said, will support 8 projects and is key part of Alberta Innovate's strategy to create a digital health ecosystem in Alberta. These innovative projects, including that of Dr. Prism Schneider, whom we'll hear from shortly, and we're also fortunate to have Dr. Matthew James, another one of the 8 awardees, welcome Matthew to this event, are contributing to the advancement of solutions that will improve healthcare quality, health outcomes, and overall value for Albertans. We look forward to seeing the successes and also the key learnings from these technology-enabled digital health projects, which we also look forward to strengthening our partnerships with all the key health stakeholders in our health ecosystem as we continue to advance healthcare beyond the 21st century. Thank you. It is now my pleasure to introduce my friend and colleague, Dr. Braden Manns, who's the Vice President, Provincial Clinical Excellence with Alberta Health Services, and he's also the we co-chair the Prius Steering Committee, which is the governance structure that looks after these awards. So, Braden, thank you.
Thanks, Tim. And you never stumbled once over the Partnership for Research and Innovation in Health System. I'll just refer to it as Prius because I can never, despite the fact that it's been going since 2014, I can never remember what it stands for. I'm really pleased to be here on behalf of Alberta Health Services today. As an integrated provincial health system, AHS knows how important it is to actually provincially spread and scale new innovations. And Prius is actually the first part of that. So with Prius, it's about how we effectively implement and test new innovations in a part of the province before we make an investment to spreading and scaling that provincially. We've already heard that there's 8 projects being announced happening across Alberta, but they're going to be helping with system flow, which is a really important priority for all of Albertans at this time where our health system is. So these innovations will help flow across the system. Some of them are in acute care, some of the innovations are in primary care, and some are actually around prevention and how we use the health system to embed prevention within that. We want to make sure that the right patients are occupying the right spaces in our health system. That doesn't always mean being inside hospitals. So through this competition and the types of work that it's supporting, we're looking at improving Albertans' access to care across the province, and digital health can be an important tool in that. So AHS, in the context of Prius, it collaborates with all the important stakeholders, so patients, health practitioners, government, the individuals that help us run virtual health, HealthLink, all of the important partners. Patients are really important in this competition. They're actually embedded in all of the teams, from the generation of this is an important idea and they've experienced it from the patient's perspective, to actually planning the project, to what the evaluation measures are that they want to impact, and they'll be involved all the way to publication of the findings and making sure the program is sustained. So digital health, we've heard different definitions of what it is today, but it's anything from virtual health. Now you can see your doctor through Zoom, which we weren't doing nearly as much before. Digital health is also about things like the virtual physician line within HealthLink. When you call 811 now, you may be patched through to a physician to speak about your problems. And so this is about how we actually embed digital health intentionally within our healthcare system to improve capacity in our urgent cares and our emergency rooms to be able to see patients as quickly as we need to be able to. So one important enabler for Prius are our Alberta Health Services Strategic Clinical Networks, which are those networks of on-the-ground practitioners, patients, governments represented there, communities. And they're really an important enabler to work with teams like Dr. Schneider's to get these programs embedded in the system. And hopefully they work, and then we sustain them in the system. So this funding announcement is really a smart investment for Alberta. For Albertans, regardless of where they live in the province. And so our thanks to Dr. Schneider and Dr. James and the other successful applicants, but as well to the other stakeholders that are involved in this today. So Dr. Schneider, I'll invite you up. So Dr. Schneider, I see her in the hallways of the hospital. She's an orthopedic trauma surgeon. She's an associate professor of orthopedic surgery. And as you've heard, she's one of our successful grant recipients today. So thank you, Prism.
I'm down here. Well, good afternoon. Thank you so much for the opportunity just to speak about something that we're so passionate about. So osteoporosis is often referred to as the silent thief. Interestingly, there is no sign or symptom of osteoporosis until the first fracture or broken bone. And most commonly, this is a very low energy injury, so a slip and fall on ice, very common in Alberta. And so until we're aware of this low bone mass or osteoporosis, it's really difficult to identify and help patients. Currently, at the moment, in Alberta, over 250,000 people are living with osteoporosis. And what this means is there are up to 22,000 new fragility fractures every single year in Alberta. This actually equates to a cost to our healthcare system of over $100 million every single year. So without early identification of osteoporosis, appropriate investigation into the severity of bone loss, as well as appropriate intervention, which can mean education for our patients, as well as potentially medication therapies, this problem will continue to exist and only grow with our aging population. So our innovative digital health solution, the POWER program, is called it's really embarking on sort of new and emerging technologies in order to support sustainable and accessible care for Albertans. And so we're going to use technology in order to improve access to those who may have limited access, rural, remote, underserved communities. And we're going to use this technology to help bridge the osteoporosis care gaps that currently exist. So this provincial power program will actually be the first 3-eye outpatient fracture liaison model in Canada. We will identify patients at the time of that initial fragility fracture. We will request appropriate investigations to look into the severity of their osteoporosis, and we will initiate evidence-based and, probably most importantly, personalized healthcare through our digital health solutions, as we mentioned, a smartphone app, electronic resources, and access to physicians regardless of where you live in Alberta. We really hope to promote patient self-advocacy and to engage and empower our patients for lifelong bone health. It's important to note that this program was co-designed with patient partners, and they played a tremendous role in how we've designed this program. It's also been interestingly informed by the COVID-19 pandemic and utilizing existing and upcoming novel digital solutions. So with the support of Alberta Health Services, the University of Calgary, Alberta Innovates, we believe that together we can improve equitable, accessible, and cost-effective osteoporosis care for all Albertans. And our goal is really to make all Albertans unbreakable. Thank you.
Wow, it's so exciting. Congratulations to you, to all the 8 winners for these exciting time proposals that are making the future reality and present. Digital health is not science fiction. These kind of technologies make it present and make it here and now. This is really important. The take-home message, you also mentioned it in your presentation, Prism, is that this is what allows those who don't have access, readily access to healthcare in remote communities, underserved communities, get access. Healthcare is for everybody, for all, and now it's happening. So thank you for that. Congratulations again to the 8 recipients. It'll change healthcare, obviously, throughout the province. Super progress going forward. Your innovations in digital health clearly have the potential for tremendous positive impact. And we really look forward to the time in 24 months from now when we see the results of this. Thank you also for the government to support, to step in. It's teamwork. The only way you can deliver these kind of programs is we work together as one team. So thank you for being part of this team and for your support. We couldn't do it without you. University of Calgary and other institutions throughout the province, University of Alberta, our friends up north, and University of Lethbridge are amongst the other institutions with whom we work a lot in collaborative ventures. And more, even the initiatives we recognize today are collaborative ventures. And alone, in silos, we get nowhere anymore. So really good to see these institutions being leaders in life sciences, health, medical research, and this investment will support us building on our successes. The Prius program enables our scholars to align their research efforts with the needs of our health system. They will advance evidence-based solutions to improve healthcare quality and health outcomes for all Albertans, and I underscore all. Multidisciplinary collaboration is vital to mobilizing knowledge to address complex problems. And UCalgary is really grateful to work in partnership with Alberta Innovates, AHS, Alberta Health, and the government to deliver on these fronts. These strong relationships have led to tremendous outcomes, and we look forward to continuing these strong relationships. Thank you all for being here today. Very exciting times indeed, and we look forward to basically opening the floor for you to mingle and discuss. And should you have questions to some of the investigators here, I'm sure they'll be super happy to answer your questions. So thank you all for being here. Safe drive home if you have to drive. and we'll see you in 24 months maybe. Thank you very much.